Moving right along for our last panel of the day. And then, of course, we are going to get to our final awards and recognition session. I can't believe it's already been 3 days connecting with you all. How many of you have learned like 20,000 new things? Raise your hand. Yay! Knowledge is power. Wonderful. Me as well. So, our next and final panel discussion asks the question, healthcare employers as agents of change, can they lead the way in achieving equity? The healthcare industry is known as one of the largest employers in the United States. No surprise there. And with that comes several ethical dilemmas. Right now, there's an urgent call to make the healthcare system more equitable by eliminating racial, ethnic, and gender disparities. But how is this going to happen is the question. To combat persistent biases in the healthcare sector and find answers to these questions, a panel of forward-thinking business executives will present their suggestions. Let's hear it for our moderator, David Nguyen, CEO, BrainScanology, Inc. Take it away, David.
All right, we are here, and it's going to be a great panel, as the panelists have been discussing this topic over the past few days. And I mean, there's a lot of wisdom and insight to be gained and to be replicated, in wherever you are. And so the panelists are on the way up here, but each will introduce themselves and their background. But let me just say that, there's two ways to interpret the prompt or the topic, right, of this discussion session. And that is one, what can employers do to increase equity in the patient population? But another interpretation is, how can employers improve equity in the hiring process of their own institutions? And turns out these two things go hand in hand, because if the people you hire understand your clientele better, then your clientele will receive better service. So we'll be talking about both, because we think both are important. So panelists, if you're ready, please come on. Okay, and since you've naturally picked the order of seats, why don't we just go from starting with Andy, right, and then each person can introduce themselves and their background. Sure. Looks like you're all mic'd, so go ahead.
I'm Andy Plumlee. I'm an operations and efficiency expert. My most recent position, I was the operations director for Island and LaConner Drug in Oak Harbor, Washington.
My name is Dr. Liza Ekole. I am with Dr. Liza Ekole, Inc., doing business as collaborative relational intelligence. I was previously the senior clinical consultant for physician engagement covering the state of Michigan. I was put there by Cigna, but now what I do is I train medical doctors without residency on how to provide value-based care services under the supervision of physicians. I'm also a speaker and a philanthropist.
Okay, wonderful. Carley?
Carley Applegate, founder of EvelynElaine. I have 75 employees between Wyoming and Montana agencies, and currently serve around 400 clients. So this subject I'm excited about this subject.
Hi, I'm Barry Lachman. I'm an independent consultant. I have a company, Lachman Community Development Consulting. In that business, about some part of my business is consulting to managed care companies and providers, particularly, and vendors, particularly in the government-sponsored space, Medicaid, and the marketplace. And the major part of my business now has been working on equity in community organization and building out creative programs to address social determinants of health. I had 26 years as a medical director in managed care organizations. Early on in my career, I organized a mentoring program to increase enrollments in medical school and health professions. And so throughout my career, the whole question of how we increase people from minorities and disadvantaged populations has been part of my focus.
Wonderful. Okay, well, let me ask some questions, leading questions, because I've talked to our panelists, and so there's certain things that there's in their experience I'd like them to highlight. Well, first off, Dr. Ekole, so you spoke at Harvard a number of times, right? And you also, can you tell us about that? And also, the specific clientele that you work with in terms of helping them transition, right, into finding, work and things like that.
Thank you. So yes, I've spoken at the Global Health Summit at Harvard a few times, especially before the pandemic. It was like every year. And basically, I go there to talk about how healthcare professionals can communicate with each other. So I found that there was a big gap in the healthcare industry. So I started off as a pharmacist, and while working as a clinical pharmacist, I noticed that the lack of collaboration among healthcare professionals was costing the healthcare system billions in dollars. And coming from a third world country, that really talked to the string of my heart, because that could be a budget for a whole nation. So I wanted to figure out how to solve that problem. As you all know, practitioner-based education does not really focus on interpersonal skills, yet it is an industry where you have to talk to people. So I went on this journey, pursued a PhD in leadership, and from there I developed 2 leadership frameworks: collaborative relational intelligence and the double rhythm role. From there, I was able to take that knowledge and start teaching pharmacists, nurses, and other healthcare professionals how to effectively communicate with physicians. Physicians have a language, and if you are in the healthcare field, a lot of times they will say, oh, the doctors are not following through with this, they are not doing this. But I realized that when you start speaking the language of physicians, you get their buy-in, everything changes in the hospital. So I've done that, put that into practice, saved millions for hospitals, and that is what I do, and that language has actually transformed a lot of healthcare professionals and organizations. So I get called to speak on this interpersonal and interprofessional leadership techniques that also helps to bring that burnout, because a lot of burnout issues as a result of poor collaboration and communication. So I also use that to train a lot of students in medical school and pharmacy school, and the one thing I hear is, how come nobody told us about this? This should have been the first lesson we learned day one. I also speak to medical residency programs on how to speak to each patient based on the way that they would like to be communicated to. And it's really very simple. And the feedback from those workshops are just so eye-opening. So I think that in this relational age where career success is really not, it's just 4 to 10% IQ, but the other 85 is how we relate to each other, because people are looking for good experiences. There are many doctors, we have the internet, and so I think this is the new competitive edge. Thank you.
Wonderful, thank you. And next I'd like to ask Andy. So Andy is an expert in operations and efficiency. He's also a champion in getting people vaccinated, and he had really brilliant ideas that are, I think, out of the box. So Andy, why don't you share a bit about that?
Sure, thank you. Well, Whidbey Island is a rural area. As you can imagine, it's difficult to get healthcare providers in such an area. And when the pandemic happened, what you saw was anyone with any type of healthcare experience went to the larger hospitals where they were needed. So this left a challenge for a small community of about 20,000 people. How do we take care of our community? How do we vaccinate our own? Well, healthcare is very regimented. It's got a lot of gatekeep. Keep a lot of very qualified people out of the industry because they don't have credentials or they don't have specific training. But in this situation, we couldn't do that. So turns out people with really good customer service and really good skills at dealing with patients who may be nervous or worried, such as in a pandemic, they're working as bartenders. They're working as retail associates. People who are really good at following a process and getting something from A to B, they're working as line cooks. They're working as sous chefs. And people who are really good at noticing when something's not right, even when someone's trying to hide all of that, your mothers, right? They know when something's wrong. And they have these skills that are being overlooked. Well, it turns out that you don't need a physician or a pharmacist or a nurse practitioner to do anything when it comes to a vaccine other than put the needle into your arm. The healthcare questionnaires, the monitoring of you after your vaccine, the recording of your medical history, the reporting of it to the state, all of that can be done by people that don't carry credentials. So we created an assembly line. And my team of 7 people in an 11-hour span on their best day vaccinated 1,608 people. We caught the attention of Seattle's mayor, former mayor Jenny Durkin, and the Housing and Urban Development Department, Northwest Region. When it was reported that Lumen Field and the National Guard, Washington National Guard, over a 7-day span vaccinated 25,000 people at one of their mass vaccination clinics. But when the reports came out, my same team of 7 in that same time span had vaccinated more than 31,000 people. So healthcare does not have to be a big drawn-out process. And it does not require years and years of experience to find qualified, competent, and very capable practitioners in some unique places where we might not be thinking to look.
And let me ask you that. So, I mean, that it requires a certain degree of leadership, right? I mean, you noticed, that talent pool. It was untapped, and so did you by yourself activate them, or did you have to train sort of middle managers to also relay the message?
Well, I think what we did was we trained them for the specific task. And it's important to remember that these are individuals who may have been kept out of the healthcare industry. Maybe they applied to a dentist office or a doctor's office at some point. The leadership didn't take a lot to motivate them because for once they were given an opportunity that maybe in the past they'd have been told you don't qualify for. So they really had a strong desire to prove that they could achieve something that everybody was saying was impossible. And good teams make leaders look better than they really are. And if I'm being honest, I had one of the best teams you'll ever find. So,
Awesome. Okay, next, I'd like to ask Carley to share in her experience in terms of hiring the staff and equity and just capitalizing on the talent that comes from her practice.
I think one of the biggest challenges that you see in post-acute care versus maybe acute care is you see a lot of nurses who are really good nurses, right? They're dependable, they come to work on time, and that at times qualifies them for a leadership or management experience. And then they fail at that, and the cycle just repeats. And so, that puts that doesn't just put those clinicians at a disadvantage. It puts everybody underneath them at a disadvantage. The turnover is a disadvantage for that agency or that facility. And so, looking for those leaders that have been hidden, I think is really, really important. It's challenging though too, because providers want to see vetted individuals, right? They want to see the credentials. They want to see the license on the wall. And I found that that's not what you necessarily need. Just because somebody has come out of nursing school with a degree does not mean that they've received any amount of management skill or business acumen. I mean, when it all is said and done, each one of these is a business, you know, and there are some basic standards that need to be met. You need to meet payroll and keep the lights on and keep your vendors paid. And so, you know, really identifying people with just, I guess, you know, a good foundation in which to build those leadership skills on, but you gotta build them, right? They don't come innately to anyone. And when you do find those people, it's the onboarding process that I think really makes a huge difference, because again, most of my experience being in post-acute care, you bring these employers on, I guess, expecting that your competitor trained them well. You know, and so these individuals, you know, they're getting maybe 4 hours of onboarding, and that includes, you know, the I-9s and W-2s and maybe the background check, but nothing about vision, mission, leadership, expectations, standards, right? They're thrown to the floor, and then again, we wonder why they fail. And I don't think that you can have an equity program without having equity for your staff, right? If you're not taking care of your staff, it doesn't matter, really. I mean, client care isn't going to matter, because if you don't want to make your staff a priority. And so one of the things I always challenge my management team with is, how much time would you spend training, say, a physician? Oh, well, we would have to do this and this and this and this and this. How much time are you spending on training a CNA? Oh, well, you know, maybe a couple hours. We show them where the bathroom is. We show them where to clock in. No, it should be, I mean, we should be really spending the most amount of time with, as far as training, development, leadership, with the people who have the most contact with the clients. And if you do that, then you can start talking about equity. But if that's not your process, having that conversation, having that equity, going to a training, having the policies, you're just wasting your time.
Wonderful. And so let me do a little bit of summary in terms of themes that I picked up before we get to Dr. Lachman. I know you have a lot of valuable things to share. You know, so the theme I'm hearing here is that in order to have equity in terms of your workforce, right? One, you have to allow them to grow into their roles. You say, right? You can't expect them to come in fully trained, never making a mistake. That's just, you know, it's not gonna. First of all, that doesn't even happen even if they're fully trained, right? And so allowing people to grow into the role, okay? And the second thing I'm hearing is that culture has to be intentional, right? Including the culture of allowing people to grow into their roles, training them to deal with, you know, or to interface with clients. And that's something that has to come from the top, right? It has to be defined by the leadership, right? As opposed to expecting that your competitors have fully trained, you know, your new employee, even though now they're in your company culture. Right, so those are the themes that I'm hearing. Anything that I'm missing there in terms of what the first three panelists have shared?
Well, I think it's important to recognize when you're talking about the leadership fail cycle, there's a certain protectiveness and resistance to liability with that, right? If I hire that person that has those letters behind their name, then if it goes bad, I at least can stand in front of my boss and say, but they were qualified, right? Whereas, and one of the challenges, like for me, when I talk to healthcare facilities and I show them all of my success, they'll look at it and go, yeah, I mean, yeah, you did all of this in food, you did this in military, but what do you know about running a healthcare? Well, I don't know anything directly about healthcare, but I know how to get the results that you're looking for. I know how to cut out the waste. I know how to find good leaders. I know how to train candidates. And that's what you're missing. Yeah, we really need a clinician that's gonna, you know, keep us liable.
Yeah, and I think that's where people get, one of my best home health administrators is a retired teacher, right? My best clinical director at the moment, and she is a goddess. She's an occupational therapist. You know, and so again, yes, there's some minimal credentials that you have to have per regulation or state statute, but you know, when we keep those positions in a box for liability, you just
Create that cycle.
you just create you perpetuate.
All right,
It's
Dr.
like-
Lachman,
You know,
please.
one of the things that I've learned from my community organizer training is that change and positive change is fueled by anger. It is people who are angry who want to make change. There's a large difference between anger and rage. Rage just provokes reactions and it doesn't lead to progress. But anger is good in people because they can use the energy from that to produce change. And so as I've been reflecting on my career, early on I would have the reaction, oh, this person's not measuring up, and forcing them out. But when I forced people out, I let them know why, and several of those people came back to me and told me how much it changed their career and made them successful in the next place. Later in the career, I would identify those individuals with that anger that bordered on rage early, and I would sit down with them and say, I love your energy, I love your desire to produce change, but here's how your rage is getting in the way. Let's work collectively to use your anger to produce the change that you want without the rage. And that for me was enormously successful. The people I've worked with in that are, you know, quality director for a major healthcare system now, progressed up through the works, the compliance director for a large HMO, because they were able to take what they were learning and build on it. And those are still the people I'm connected with on Facebook and LinkedIn and all, and because we have that mutual development of the team. The other thing is that one of my staff members in my previous job told me that I was not an out-of-the-box thinker. She said, because there is no box. And I think a part of it with people who are creative is encouraging their creativity with keeping them within the bounds of the possible. And to do that, you have to help people build. So to your point, you need to have a training program that encourages individuals to follow their passions in the job, to promote the kind of growth that brings your company and yourself forward.
Wonderful. So all that takes me back to what Dr. Ekole talks about, what she does in terms of training, right? So the theme I'm hearing across these panels is that you have to be attentive in seeing what that person's anger is, not what their rage. And that quote unquote anger could be that they're great caretakers, right? You're a top caretaker, right? Or that they might have skills that aren't credentialed, but they're great at getting people to access medical care.
I want to follow up on the anger rage thing with an example from people we all know, okay? The two people who some of you may not know. Everybody knows Malcolm X. Malcolm X was able to translate his youthful rage into anger to produce change, okay? At the same time that Malcolm X was prominent, there was an author by the name of Eldridge Cleaver. Eldridge Cleaver wrote a book called Soul on Ice that was very popular. Cleaver never went beyond his rage. Everybody knows who Malcolm X was. Does anybody here besides me, know who Eldridge Cleaver was? There's your example.
All right, and so we recognize someone's potential and we grow that potential. But I think that the recognition process itself is a skill that needs to be developed, right? I think it's part of leadership skill, right? And of course, Dr. Ekole, is that part of what you train people to do in terms of, interpersonal communication?
Yeah, absolutely. And just to piggyback on the feedback, studies shows that a lot of managers, directors don't take time to give feedback to their employee. So imagine the feedback that, your employee got, right? And if we have an institution where this feedback is given regularly. In CRQ, Collaborative Relational Intelligence, we call it care fronting, where you provide accountability in a caring manner. And the example that he gave, he never attacked the person. He talked about the issue. And if you do that consistently with everybody in a just way, and you do that by asking open-ended questions, everything begins to change in your organization. But the key is you have to, first of all, realize that it has to be done. You have to make sure that you're doing it in a caring way. The other important aspect of providing feedback is understanding the personality of each person. So for example, there are 4 different types of personality that generally I would train on. And there's the one that when you're talking to them, you talk to them in terms of what is in there for them. If you do this, what is in there for them? There are some that you want to talk about who will be there with them if they do it right. And then the other one, you're talking in terms of, how they can come in and support an issue. And then the 4th one is you are speaking to them in terms of why. The reason why a lot of leadership and teamwork has just become something like, how do I call it? It's just like basically nonsense, because you hear teamwork, collaboration, and it doesn't really mean anything to employees anymore. It's because nobody really understands what that is. But when you start working with people from an interpersonal level, everything else falls in place.
Wonderful. Yeah, and that, the story that Andy told about how, he was able to train up people who weren't credentialed, but who were great at, getting people to access vaccinations. And essentially, you said a lot of it is they have skills in the service industry, right? They're the bartenders. And I also mentor a number of students, before I was a computational biologist. I was also an education consultant, and I once worked with this, female student, high school student, and we were working on her resume, and I asked her, what internships do you have? And she just turns to me and says, I just serve coffee at a cafe. And so I looked at her and said, have you ever heard of the person called the Secretary of State of the United States? She says, yes. I said, well, that person, when the president is busy, the president sends that person to negotiate a ceasefire to prevent nuclear war, right? And so the skill set that is required to prevent nuclear war, you're not going to learn in calculus. Do not send an engineer to negotiate a ceasefire, right? You send somebody who knows how to receive demands and yet smile, right? Like a coffee barista. Somebody walks in and says, I want my coffee super hot, but I don't want it to burn my lips. And as the barista, you're thinking, this person's out of their minds. But you smile. This is, how's your day going, sir? I'll get right to you, right? So it turns out it's the service industry, customer service, is what makes for great leadership, right? Great managers, right? And also great interpersonal skills.
Can I just add one last thing? And that is also very important. You see, right now, patient satisfaction surveys, part of the question will be, did the doctor speak to you in a way that you understood? They're asking those questions about nurses too. So a way to actually help take patient satisfaction surveys up in the hospital is to be able to teach doctors these skills, nurses these skills, that your patients are not going to be the same. There are some that you give them the facts, some that you speak to them in terms of why, who, and how. If you don't do it, you are creating conflict, because the way you talk to one person and they appreciate it, if you do it to another person, you'll be causing conflict. And so when we get to the nitty-gritty of things like that, everything changes, even in acknowledgement. Acknowledging people, there are people that will not want the public kind of acknowledgement. So all of these dynamics are really important in this relational age in making healthcare more competitive, not just for our patients, but even as healthcare professionals.
I think what you're saying about conflict is really important when we're talking about management and leadership, and when you talk about those skills, right? Because as managers, we like to think that managers and leaders they always make the right decision. They always have the right information. They always know what to do. But human beings all have bias. We all have our own preconceived notions of things, and we tend, even as managers and leaders, to hire people that look like us, that act like us, that think the way we do, because it validates who we are. And one of the hardest things for managers to do, especially when talking about equity and talking about avoid that conflict that comes from, is looking at ourselves and saying, I need to hire for my weakness, not for my strength. I don't need somebody that does the things I do well, right? Personally, I'm a very good solutions person. I'm a very good person at coming up with ideas. I am horrible when it comes to mathematics. I am horrible when it comes to organization. And I will overbook myself 3 times in the same hour. So when I hire somebody, it needs to be somebody that is very task-driven, very organized, very good with numbers, remembers dates, remembers who I met when and what I talked to. And if I don't hire that way, then all I'm doing is setting myself up for failure. But so many managers fail to do that because they worry about the conflict that comes from having someone like that.
I need that detail. Oh, go ahead. Yeah.
Oh, I just wanted to challenge that just a little bit, just because in healthcare, when we're talking about healthcare and equity, right? We have yet to establish equity across the healthcare workers, right? You know, we had the pandemic, and you had, you know, people going out and hanging flags, and nurses and physicians are our heroes and everything like that. And you know, some people have talked about this, and I talked about it in one of the earlier panels too. You know, for every nurse or doctor that you see, there are 10 people in back rooms. They're in the laundry room, they're in the cafeteria, they're cleaning, they're running central supply, they're managing the data. And, you know, we've gotten, you know, and I don't know if we've gotten to that place. I can't remember in my entire career when we haven't been to this place where, you know, you may approach somebody at a hospital or a nursing home or a facility and, you know, ask a question like, I'm sorry, I'm just right? I'm just a janitor. I'm just a nurse. I'm just a rad tech, right? Again, there's not a single person in a facility that isn't absolutely needed. Budgets dictate that, right? But, you know, we want to, you know, we want to talk about equity, and we want to talk about leadership, and we want to talk about these things, but we haven't even established that everyone in a hospital is equally needed. You know, and that's despite race or creed or anything like that. Just by job description, you know, we have, again, and that's all of our fault. It's not one person, it's not one industry, but, and again, this is, you know, post-acute care and such. Oh, you just work at a nursing home. Well, you know, you just work at a law firm or whatever. Like, you know, we've created this internal hierarchy that depletes the opportunity for equity because we don't even recognize all of the different disciplines as equal.
Dr. Lachman.
Yeah, I want to shift it a little bit because one of the things we've not talked about is we've touched on the workforce and the people who are out there who have skills, but a large part of, I got into community health by spending time in North Philadelphia on the playgrounds playing basketball with teenagers, who many of whom were in gangs, who blew my stereotypes as a suburban kid coming from the suburbs. And I saw a tremendous amount of talent that really went to waste because the people were not offered a pathway to achieve more, and they lost hope. And a part of what I do now, one of the pillars of our work on social determinants of health is around workforce development, and it's identifying people. We're trying to identify people, as has been said, who have interpersonal skills, because so much of healthcare is interpersonal skills. And our entry pathway in healthcare is community health worker. Community health workers have a very robust evidence that they improve outcomes. But in order to be successful at that, you have to have a lot of people skills. And we are partnering with Dallas College, which is our community college system, and with a program called Skill Quest Dallas. And SkillQuest Dallas has state funding from the JET Fund, they call it, to offer the wraparound services that people need to succeed in middle and higher level education. And we have developed several career pathways that we're trying to develop. One is in healthcare. An example might be that you come in as a community health worker, you become interested in asthma, you pass the asthma educator test, which you don't even need a high school degree, you just need to know your facts and pass it. And then you can go into being a respiratory therapist. You can do the same thing into nursing, into nutrition. And so by doing that, we're creating career pathways through that combination. We have a similar pathway that we've identified with one of the people that I work with who's a developer. And there we're building into the skilled business trades and things like specialized drywall. There are tremendous shortages of people, and these jobs pay $30 an hour. So we can identify people, train them up through the program, and bring them into that. And our last area is urban agriculture, and there we're working with the Texas A&M Ag Institute to train master gardeners out of communities. Those pathways exist for us in so many different places, and this is a way of identifying people in communities, giving them hope, and giving them a way out of their circumstances. One of my key partners in this development, in this work, is a developer who did it himself. Not everybody has the skills that Alonzo Harris has. Alonzo Harris made it out because he was skilled in basketball, played for TCU, and got his degree. And then he began building houses. He is now building $250,000 houses across from the housing project in South Dallas he grew up with. We need to create the mechanisms that make it possible for our children who have talents, regardless of their racial and ethnic status, to achieve in American society. And to do that, we have to confront the racism that's part of all of our training. I've spent 50 years confronting mine. I hope I've come much beyond it, but I still learn every day. And we all need to be honest enough to understand what our upbringing and our society did to us so we can be better and so our children and grandchildren can continue the work.
Well, thank you for that vulnerability, Dr. Ekole.
Yes, what an important point. So let me backtrack a little bit and go back into healthcare shortages. Right now, the Association of American Medical Colleges has projected that by 2030, we'll have about 125,000 shortages in physicians. We have a problem of getting doctors that are qualified, trained, getting into residency. You have international medical graduates that are surgeons, cardiologists from Europe and other African countries that the ECFMG have verified that they have medical degrees. But because, first of all, the way the standard is set, they go through a filtration process where the computer can pick and say you're an IMG, so you don't fit this program. So more than 50% of them are out there without any opportunity to get into medical school. Imagine spending your entire life going to medical school. And I know for a third world country, that is a saving for a whole family. Now, healthcare has opened up to the point where we're going towards value-based care services, whether we like it or not, which means doctors now need extenders to help them capture all of these services. Our doctors are burned out. We all know that. And we have qualified individuals out there that don't even know that there are opportunities for them in the healthcare field. So with that knowledge, I put together a program called the CRQ, 4-Step Value-Based Program. It is an advanced program that trains these medical doctors on 7 skills or value-based care services that are reimbursed by Medicare. And by so doing, they help these physicians capture all these services that they are not capturing. And wow, this has been life transforming. Some of these doctors have been doing Uber, working in gas station. I'm not saying doing Uber or working in gas station is a bad thing if that is what you want to do. because they didn't know that there are opportunities out there for them. By so doing, they are gaining the experience that they need to get into residency. They are able to make money because they are depending on their family members, taking money, applying for residency program after residency program. So when we talk about workplace equity, I think this is an area that we need to look at because access to healthcare in rural areas is a problem. Yet we have very qualified professionals that have been trained to be problem solvers, doing things that we have other professionals that do this here and there. But we have a program in place where we teach them, we go through the process with them, have them use computers that are audit ready, and they are doing a tremendous, tremendous job with the doctors that they are working with right now. My hope is that healthcare professionals, the healthcare industry will start looking at these professionals and making room for them. As a matter of fact, the COVID bill, they passed a law after 20 years to open up 1,000 more residency spots in America after 20 years. So my hope is that they'll be looking at these international medical graduates, these graduate physicians that have not had opportunities to give them some kind of priority. So I'll end right there so my other colleagues can talk, but this is really a hot topic, and I think that if we're talking about workplace equity, we should also look at areas like that. They are not licensed, but they are qualified.
Wonderful. Okay, so
I
yeah, go
actually,
ahead.
it's an issue not just with physicians too. I mean,
Yes.
I had CNAs who in other countries, they were a nurse or a midwife. And then they come to the US and I think it's more of a regulatory issue than anything else. Absolutely, because, again, they're qualified, but not.
No, it's not.
Right, they don't meet the whatever rule that is for that state for their practitioner or, but I'm sorry, I was saying I've seen other disciplines come from other countries and not be able to practice because of that disparity.
I think it's not just a regulation.
go
Let me
ahead,
clarify
finish.
that. It's more like the understanding that they can do that. Because some medical assistant can do that. There's no law that says if you have a qualified individual in your office, they cannot help you with chronic care management. So it's not a regulatory issue, it's an issue of education and information in this instance.
I think to add on to that, I mean, you see that across the entire spectrum, right? Because when you talk about socioeconomic standing, you see very intelligent people. The first wave of the pandemic was people that were 75, 80, 90 years old, people that are not necessarily tech savvy. And you had to have everything done through tech portals. So our solution was hire high schoolers. Now, they're not medical professionals, but there's nobody out there better with technology than a high school kid.
That's brilliant.
But when you go and talk to them, when you go to the lower socioeconomic communities where high school kids are going to want to get a job, let's just look at the reality of this. It's kids that are hungry that are willing to go to work after school. They don't even believe they can be in healthcare. Well, I can't work in a pharmacy. I don't know anything about that. I'm going to go get this job at McDonald's because my buddy says that's where I belong. You see the same thing when you bring someone from another country. We've got to change the mindset that healthcare is something that you aspire to be in, and it's something you can grow in.
Yeah.
I think that's
Wonderful.
challenge.
Oh, sure.
One of the first things I did in community health, we had a effort where I see it's picking up again, interesting because nothing's changed. The percentages have not changed in the last 40 years, but the medical student community in the late 60s took on the issue of minority enrollment in medical schools. And we began confronting the medical schools. We seized the platform of the American Public Health Association to condemn them for not doing it in public health. But we along with it, we had to develop programs. So I developed a mentoring program. And what my mentoring program did is I recruited 50 of my colleagues at Temple Medical School. And they were paired with a student from a local high school. And we then compiled a list of everybody who we could find in various who were minority, and there weren't that many, in various different positions. So there was an adult surgeon who was African American. There was a radiology technician, a lab technician. And the job of this student was to sit with their high school student, take them around to see what those jobs were, because to the point that you made, they don't even know those jobs are out there. Everybody thinks they have to go through 4 years of college, 4 years of medical school, 3 to 5 years of residency training to have a career where you earn a decent job in healthcare and to do good, and you don't.
That's true.
Wonderful. Okay, we're reaching the last 9 minutes, and I want to close the last question. I want to take this to another level of realness. So we've talked a lot about leadership and what to do. The thing is that we're human. And I myself many times have said the wrong thing and stuck my foot in my mouth, right? And a previous panelist talked about how he had to learn to forgive his coworkers, and that saved the company from tearing each other apart because they were all CEOs. So can you tell us stories about what are opportunities? Say you make a mistake. How do you make up for that? I'm sure we've each stuck our foot in our mouths plenty of times.
I would say that you can't make up for a mistake. You can acknowledge it. Right? You can say that wasn't the intended outcome, or that didn't go the way I thought it was, or just I was wrong. And I think that carries a lot more weight than trying to fix the past. And if you operate with positive intent, if you invest in your team, if you give them the space to make mistakes, a young teenage kid working in a pharmacy for the first time may say something to an elderly patient when it's rushed and not realize how that came across or how they felt disrespected. Well, you don't fire them, you don't belittle them, you don't say, you don't belong here, this isn't right. You say, as your leader, I failed somewhere because I gave you a platform that allowed this to unfold. So let's sit down together and let's figure out going forward what our game plan is going to be. And you give them that space to take that same ownership. I made a mistake. I said this. Okay, wonderful. And now let's move on.
Wonderful.
Very important question. So in the collaborative relational intelligence leadership framework, the 10th leadership branch is self-introspection. So what I teach and what I practice that has been really effective is at the end of the day, I just make time to self-reflect on my day. When somebody lies to you is one thing. When you start lying to yourself, it's self-indictment. And I just kind of replay myself, and I ask myself the honest question. In this conversation, did I relate to this person the way they would have liked to be related? Because sometimes you don't make a mistake. You don't think that you've made a mistake because you feel that you've treated people the way you would like to be treated. In this age, if you treat people the way you would like to be treated, you will feel cataclysmically. Are you really relating to them? Did you respond to them the way that they would have loved you? And if honestly, I realized that maybe I did things in a way that needed adjustment, if it's something that I can apologize the next day, I'll have a game plan. There are some things that I just pray about it and then I plan about what to do tomorrow, not to repeat that mistake. And I just baggage it and put, as you said, you cannot undo a mistake, but what do? I try not to take it forward the next day or apologize or have a conversation. And that regular habit of just having self-introspection and going back and thinking through things has been transformational. And I get a lot of feedback from people that put this into practice, how well it has transformed them and how it's made them more self-aware and put them in the presence.
There's a running joke in my company. It's been 45 minutes. Carley must have made a mistake, because I don't know. There's a day I don't screw up, and it's just one of those things that you just kind of embrace, right? Perfection doesn't happen, and it shouldn't be expected. And if I screw up, I fall on my sword. I go to the person I screwed up with. Whatever it may be. But that also has to be coupled with love, too. You don't have to like your employees sometimes, but you do need to love them. There is a difference, right? They need to know
That's deep. Yeah.
that you are, a safe space. People make mistakes all the time. I would rather have 100 employees that make 100 mistakes every day than somebody who's hiding it, somebody who's pushing it under the rug, or, I want to have 100 employees that learn from 100 mistakes every day, and really embrace it. So, again, I make mistakes every dang day. I mean, it would be a miracle if I gone through 24 hours without screwing something up. But I think just, again, not just being the expectation that everybody's going to screw up. Everything's fixable. As long as you didn't lie, everything's fixable.
Flexibility.
You can look as a mistake as an opportunity to do better. And I think that acknowledging that mistake and moving on, and I think the point that faith teaches us a lot, and my faith, Jewish faith, we have the concept of repentance. The whole idea of our most important holiday is acknowledging your mistakes and even the ones you don't recognize, and seeking forgiveness of them, and seeking forgiveness from the person that you wronged. And then, most important of all, committing yourself to trying to do better the next time. Another thing that's important to realize is God's the only perfect thing. I'm not perfect. And if I am not making mistakes, that probably means I'm not trying hard enough to make change and make things positive happen.
Wonderful. Any questions, please line up with the mic. We have a few minutes left, but we have a lot of time. Okay, never mind. Don't line up. Sit back down.
Yes, it's 3 minutes.
Yeah, we got the ticker coming at us.
Yeah, that's right. It was just very
40
misleading. EV team, that's very misleading. Okay.
So we have, okay. I was going to piggyback on an important point that you made about we are prone to hiring people that are like us. So, and then you added, what you did, you added another reason how, why bias can come in workplace. So it's true, it's really very true that we have to be careful not to just always want to go for people that are like us, but look for people that are different from us that can help us be a better team. Because, there's something called unconscious bias, and we all have it. People like people that are like them or people that they want to be like. So even if somebody was to hire maybe somebody that cleans the floor, if they have that outgoing personality, they'll be drawn to them more. But if you are conscious and you challenge that unconscious bias in you, you are looking for somebody that is different, that would do that task the way it is. So this is what happens. When you see somebody, there are filters in your brain that will either delete, distort, or exaggerate information. And you will do that based on how you were raised, based on your personality, based on so many different things. So those challenges are there. So I like it when you said, be careful not to just go with who is like you, because it means you are being conscious to challenge that unconscious bias that is there. And that's also really very important.
Well, and, to clarify, with the unconscious bias, again, in healthcare, we have that unconscious bias with just the roles or the departments. You may have a CEO in the laundry room, but if that staff is not equal to anyone else, then you'll never find them,
Are you saying in healthcare that is what is being practiced, or that is what unconscious bias should be?
No. I'm saying that's what's practiced.
Oh, this practice, okay.
This untold hierarchy of who is important in healthcare, right? And we spend a lot of time on clinicians. We spend a lot of time on physicians, but there's a whole bunch of people that make a hospital work, and that's what I'm saying. We don't even have equity in our own industry.
And without those people, the physicians, we can't function.
No, absolutely
they
not.
are
But we
absolutely.
don't recognize that, and until we recognize that there is equity in the jobs, in the importance of those jobs, it's really going to be hard to have equity for our patients.
I want to tell a story that's the opposite side of that.
And me too.
So Ron Anderson, the late Ron Anderson, hired me at Parkland in 2001. And right after I got into the job, Ron called me up and said, let's go out to lunch. I want to know how it's going. I've been on the job like a week and a half, 2 weeks. And I go over to the executive suite at Parkland, and Ron and I head out to have lunch at the local Mexican restaurant where the people who owned it were his patients, it turned out. And as we head out the door, there's a guy there sweeping the floor. Ron turns to the guy and says, Jorge, how is your mother doing? Is she doing better? What's going on with her? And he sits there and talks to Jorge about his mother and the situation. And right away, I was transformed. I gained so much respect for this man because he cares about the people around him and has that connection with people. And, you know, this is the guy who is the CEO of a billion-dollar hospital. And he takes the time to know about the people he works with, about their lives, and to support them. That is the kind of humanity to me. That's the kind of human being I want to be. That's the kind of human being we need to make us propel forward and to create those teams that we need to move the health industry forward.
So
Yes.
I'd like to offer a different perspective when we talk about finding the CEO in the laundry room, right? My father was a janitor, worked in a hospital, worked in courthouses. One of the challenges I think you're facing is you've got to expand what the definition of healthcare is. Because in the 40 years that my father worked as a janitor and pushed around a cart and picked up trash, he was never in the law profession. He was never in the healthcare profession. He was in environmental services. He was a janitor. He was, a sanitary specialist. So he could move up in that realm and he could move to different industries, but he was never considered. So that moving up, when we look at that perspective, if you went to my father, who was a very smart man, probably one of the smartest men I knew, he never would have seen himself moving up a healthcare chain because I'm an environmental services specialist. That's what I do. I clean your office. And so yes, we need to recognize that there's talent everywhere.
Yeah.
But we also have to expand the definition of the industry, not only for ourselves, but also for the people in those industries. He took a lot of pride in what he did, right? Shortly before he retired, because he was sick, he was awarded a golden squeegee, which was a little pin. I didn't understand it, but to a man working in sanitation for 40 years, that meant something. And that meant something to more than ever us being an office manager in a dentist office or anything. He wasn't healthcare. And many of those people may not ever see themselves as healthcare as we look to them to try to create this diversity.
Leadership should, right? They're part of the team. They're essential. We need them. Again, it's a kind of a top-down.
Dr. Ekole, go ahead.
Yeah, and I like the word perspective. So we have to look at workplace equity from the standpoint of, acknowledging everybody's role. So we also have to look at it from the nurse's standpoint, the pharmacist standpoint, and the physician standpoint. So I will talk about physician because I've worked with them a lot, and I've done published a scholarly research on how to engage physician and how it changes the dynamics of things. There's a doctor that everybody knew in this hospital I was working when I started working as a clinical pharmacist. Once he calls, they announce everybody in the pharmacy, and we start laughing. Because we know that when he comes, he'll be like, what? He will hang up the phone on you. He will yell. He was this angry doctor. But the only reason why he was like that is because we didn't understand him. So after I went back, pursued a PhD in leadership, and I learned this technique, this doctor started rounding at another hospital. I started literally implementing this technique. He changed completely with me. I had another female doctor pull me to the side and said, what is it you are doing to this doctor? You are literally the only person that you can see he's calm when he talks to, even the CEO. But I was just applying this technique. But in that moment, you will see everything you want from him, you will get. You get it? And so when you start speaking the language of people from an interpersonal standpoint, they change, and they change with not just you, with everybody around them. And then you talked about acknowledgement. One last important point. Even with the doctors too, I realized that when I was running the P&T committee, I started writing thank you letters every quarter. I would thank them for the little things they have done, working with the pharmacy department to help with antibiotic stewardship, and I'll give them a pen that said, thank you from pharmacy. And what happened was, every doctor wanted a pen, and by so doing, they looked for opportunities to collaborate with the pharmacy, and the medical director asked me, what are you doing in this hospital? We started saving money, relationship change. So there are just some little leadership things that we can do to really transform healthcare that we might not know or we are ignoring.
Do we have somebody who has a question over here?
Oh, is there somebody with a question?
Okay.
No, okay, well, that's it. That's all the time we have. Thank you so much, panelists, for the great contribution. And thank you for the audience. Yeah.